Okay, so today I'm just going to be giving education to the patient about pregnancy precautions. I'm going to talk to the camera as if it is the patient. All right, so today I'm just going to talk about some pregnancy precautions. One of the first precautions that we want you to take while pregnant are certain foods need to be avoided. So you're going to need to avoid certain types of cheeses. This would be soft cheeses that are ripened with mold. This includes cheeses like brie. You also want to avoid blue vein cheeses because, again, they're made with mold and they can contain listeria. A lot of the foods that you need to avoid need to be avoided because they either increase your risk for listeria or E. coli or toxoplasmosis. Another thing you need to avoid eating is raw or partially cooked eggs and meat. Undercooked, these types of foods, when they're undercooked, there's an increased risk of exposure to some bacterias, parasites, things like that are typically they're gotten rid of once they're cooked. And infections with these organisms can harm your baby a lot greater than just if you aren't pregnant. You also need to avoid certain foods that have high concentrations of vitamin A. So this would be liver and liver products because too much vitamin A can harm your baby. You also want to avoid foods that have a lot of mercury in them. This is going to be predatory fish like shark, marlin, swordfish, sometimes tuna. You can have tuna, but you have to limit it. You also want to avoid foods that are prepackaged, like prepackaged salads and fruits, because they have a higher risk of listeria contamination. You want to avoid eating cantaloupe and bean sprouts because of their risk of listeria and salmonella contamination. You also want to avoid eating cold cured meats like salami, chorizo, pepperoni, things like that because of the risk of listeria and toxoplasmosis. Same thing for unpasteurized milk. You only want to drink or eat things with milk in it that has been pasteurized. You don't want to eat things or drink things like goat milk or cheeses made from goat milk. You also need to avoid alcohol, and you need to limit caffeine. You can have up to 200 to 300 milligrams per day of caffeine while pregnant, and you also want to avoid foods that still have dirt or soil on them because some soils have bacteria in them that can be harmful to your baby. There's also some over-the-counter medications that you need to avoid. So you do not want to take NSAIDs, like things like aspirin or ibuprofen while you're pregnant. Instead, it's recommended to take Tylenol or acetaminophen as a pain reliever. You always want to talk to your provider about taking any over-the-counter medications or supplements before you take them. Supplements that you should take are folate, iodine, and iron supplements you want to take while pregnant. And if you are vegan or vegetarian, you also want to take vitamin B12 to make up for what you're lacking in your diet. You want to avoid eating too much vitamin A, vitamin C, and vitamin E, and you do not want to supplement with these vitamins at all because too much of these vitamins can harm your baby. Another precaution that you want to take is avoiding environmental exposures. So one of the main environmental exposures that's pretty common is cigarette smoke. You do not want to smoke at all while pregnant, but you also want to avoid exposure to secondhand smoke because breathing in secondhand smoke can still expose you to harmful chemicals that have also been linked to cancer. So you also want to avoid exposure to lead, which is found in some water and paints. Typically it's in houses or paints in houses that were built before 1978. You want to avoid that because lead can be harmful to you and your baby. You also want to avoid pesticides, both household and agricultural. If you know that you're having your house sprayed or something like that with a pesticide, you want to avoid being in the house or around for a while until the fumes settle and are no longer able to be inhaled. Same thing with solvents. This is things like degreasers, paint thinners, paint strippers. You don't want to be around at all while they are being used. Because you can breathe them in. So if you know that they're going to be used, you need to avoid being around until the fumes are settled. Another precaution that you need to take while pregnant is avoiding alcohol, tobacco, and substance use. There's risks for both mother and baby when it comes to alcohol and tobacco use. Mothers have the same risks to them as any other person, but if taking like illicit drugs that require injection with a needle, you are still at risk for developing or contracting diseases like HIV, things like that. And you also, you also have an increased risk for fetus. So anything that goes into mom's body also goes to fetus's body. So any drugs or alcohol that is being taken can go to the baby, and fetuses, when exposed to alcohol, have an increased risk of developing fetal alcohol spectrum disorder, or FASD. FASD can have mild to severe effects. We don't know how much alcohol causes FASD, so it's advised to just avoid it completely. It can cause mild to severe defects, behavioral problems, and learning disabilities. So again, whatever mom takes in, baby takes in, so avoid any drugs, alcohol, tobacco, things like that while pregnant. Another precaution that you want to take is travel precautions while pregnant. So you always want to talk to your doctor before traveling anywhere so that you can be aware if you have any health issues that make traveling unsafe for you or your baby. You also want to avoid places that have limited access to safe food and water. You also want to take note of any immunizations that you might need before traveling somewhere and if they are safe for you to take while pregnant. You also want to make note of the medical care that is available in the place that you are traveling to in case you need anything for you or baby. Most airlines allow pregnant women to travel up to 36 weeks. However, it's still, you're allowed to travel up to 36 weeks, but the more frequently you travel, the higher your risk, higher the fetal risk for cosmic radiation. So if you're going to travel, they say to limit it, try not to travel too frequently. But another thing that you want to be aware of while traveling is the risks associated with sitting down for too long. So when you're sitting down for too long, it can affect the blood flow to your legs. So the recommendation is to avoid sitting for more than 5 to 6 hours in one day while traveling. And if you're going to be sitting, they recommend that you take plenty of time to stretch and move your legs, walk around, things like that. The last precaution I'm going to talk about today is precautions regarding going to the dentist and oral care. The best time to receive a treatment is between 14 to 20 weeks pregnant, and they recommend that you get a complete oral exam early in your pregnancy. You are likely going to avoid getting any x-rays while pregnant, but if they are absolutely necessary, the risk to the fetus is very small. It is recommended that you do not avoid any dental care just because you're pregnant, because some of the issues from dental issues can cause more harm to baby and mom when untreated. A common issue that women see while pregnant is something called gingivitis. So that is when your gums become swollen and red and they bleed easily. This is common mostly from hormonal changes in pregnant women, but it can also happen from poor oral hygiene. So you just want to be aware of that.